In this video, we are going to learn about the Birmingham eye trauma terminology system, commonly known as Bett classification. This is a very important topic in ophthalmology because it helps us classify ocular injuries in a systematic and easy way. Bett classification is mainly divided into two major groups: open globe injuries and closed globe injuries. Understanding this classification helps in communication, documentation, prognosis, and management of trauma cases. First, let's discuss open globe injury classification. An open globe injury means there is full thickness wound of the eye wall, which includes the cornea or sclera. To remember the types of open globe injuries, we can use the mnemonic RUPI PM. RUPI as in money, PM as in Prime Minister. R stands for rupture, caused by blunt trauma leading to inside-out injury. P stands for penetrating injury. There is only one entry wound. I stands for intraocular foreign body. Foreign material enters and remains inside the eye. P stands for perforating injury. There are both entry and exit wounds. M stands for mixed injury, a combination of different mechanisms. Next comes grade, which is based on visual acuity. A simple mnemonic is 40, 100, 200, PL and no PL. Grade 1 is vision better than or equal to 20 by 40. Grade 2 is between 20 by 50 and 20 by 100. Grade 3 is between 19 by 100 and 5 by 200. Grade 4 is from 4 by 200 to perception of light. Grade 5 means no perception of light. Next is the pupil status. If RAPD, that is relative afferent pupillary defect, is present in the affected eye, it is considered positive. If RAPD is absent, it is negative. Presence of RAPD usually indicates severe optic nerve or retinal damage and has prognostic importance. Now, let's discuss the zones in open globe injury. Zone 1 involves only the cornea, including the corneoscleral limbus. Zone 2 extends from the limbus up to 5 mm posteriorly into the sclera. Zone 3 includes injuries posterior to the anterior 5 mm of sclera. The more posterior the injury, generally the worse the prognosis. Next is closed globe injury classification. In closed globe injury, there is no full thickness wound of the eye wall. First is the type. To remember the types, use the mnemonic class mixed. C for contusion, injury due to blunt trauma without full thickness defect. LA for lamellar laceration, partial thickness wound. S for superficial foreign body, and mixed for combined injuries. Next is grade. Similar to open globe injuries, grading in closed globe injuries is also based on visual acuity using the same mnemonic 40, 100, 200, PL and no PL. Grade 1 is visual acuity better than or equal to 20 by 40. Grade 2 is between 20 by 50 to 20 by 100. Grade 3 is between 19 by 100 to 5 by 200. Grade 4 is between 4 by 200 to perception of light, and grade 5 means no perception of light. Next is pupil assessment, which is again based on the presence or absence of RAPD. A positive RAPD indicates more severe ocular involvement. Next is zone. In closed globe injuries, zone 1 includes external structures like conjunctiva, sclera, and cornea. Zone 2 includes the anterior segment structures internal to the cornea, including posterior capsule and pars pliccata. Zone 3 includes all structures posterior to the posterior capsule. This zonal classification helps us understand the extent of injury. So, to summarize, Bett classification divides ocular trauma into open and closed globe injuries based on type, grade, pupil reaction, and zone involvement. Using mnemonics make the classification easier to remember during exams and clinical practice. Thank you for watching.